Hi, in this video I'm going to be talking all about what you can do to improve your fertility. I'm going to be talking about the general things that you could do right now, and hopefully you can take away some of these tips and make some really important changes. However, if you have any other conditions like PCOS or endometriosis, then there might be other things that you could also do. So if you want some more information, please feel free to get in contact with me and I can give you some information that is more specific to you. So let's talk about the things that you can start doing right now. Now, generally, these are pretty much lifestyle factor changes. So there are some important steps that you can make. The first thing that I would say is consider your nutrition. Nutrition is so important for good fertility. It's actually the building block of good fertility. So really important to increase your amount of protein that you have in your diet. Protein really supports the development of good egg and good sperm. So a very crucial one. So nice, healthy proteins throughout your diet throughout the day. Really important to perhaps reduce your refined carbohydrates and your sugars. And those are all the lovely things, the things that we really want to eat, like the cookies and the cakes and the sweets and the desserts. But those are things that are going to dramatically affect your blood sugars. And if your blood sugars are out of kilter, then that can affect your natural female hormones. So reducing your carbohydrates and sugar will maintain a lovely balance and mean that your hormones are nice and healthy and you'll be more able to conceive. The number one important thing that if you did nothing else that I've talked to you about today is to stop smoking. Now, I know that's not always easy, and it might be that you need to get help from your doctor to help you to do that. But it is so important. And the reason being is that smoking dramatically affects egg and sperm health. We actually think that it possibly ages your ovaries, so therefore aging your eggs. And we do know that it can have a dramatic effect on the health of sperm. But what is really good is that if you stop smoking, after about 3 months, you've improved the quality of sperm because sperm regenerates every 3 months. So if you can stop smoking now, in 3 months' time, your sperm will be a lot better and egg quality will be a lot better. Now, women are born with all the eggs they'll ever have. And you naturally lose eggs throughout the month, more than one, in fact. You naturally lose many throughout the month. But what you have the ability to do is to change the health of the environment that the egg is in, and also possibly the casing around the egg as well. So by making these healthy lifestyle changes and choices and stopping smoking, you will be making a really good decision to support your egg and sperm health. So that would be the number one thing. If you did nothing else, then definitely do that. Another thing important is to reduce alcohol. Now, that really depends on where you are in your fertility journey. The Department of Health recommend that women and men trying to conceive don't drink any alcohol at all. But I think it's important to be realistic. And also, I'm very pro that you enjoy your life while you're trying to conceive. Otherwise, life becomes really miserable, especially on a long fertility journey. But it is important to reduce your alcohol content. So if you've been trying to conceive just recently, then I would say try and keep it as low as possible. And this is for men too. If you have been trying to conceive for a very long time and maybe embarking on IVF, then I would say reduce your alcohol down to 1 alcoholic drink a week. The benefit of having an alcoholic drink on a Friday evening, if you want one, to kind of kick back and relax after a busy week at work, outweighs any downsides of drinking the alcohol for sure. However, some couples choose to not drink any alcohol at all while they're trying to conceive, and that is completely your decision. But certainly reducing it as much as you possibly can would be really beneficial right now. Another thing to consider is, do you do any exercise? Exercise is not only important for our mental health and giving you that endorphin rush and making you feel really good about yourself, but it also will help with your general fertility and crucially reducing any weight if you're a little bit overweight. Now, some women might find, and men, that they are carrying a little bit extra weight, and that certainly could be the case for women who maybe have had a baby and wanted to conceive again, maybe carrying a little bit of that pregnancy weight. So getting your weight down to a normal range is very beneficial. We tend to look at weight calculation with regards to your BMI. So your BMI needs to be within the normal range, which is 18 to 24, 25. If you're not quite sure what that is, if you go onto the NHS website and look for BMI calculator, then you can work out what your height-weight ratio is and therefore work out what your healthy BMI should be and where you need to be. Certainly, being overweight, we do know, has a factor and can reduce your ability to conceive. So getting down into that normal weight range would be really important. For men, this is a really interesting fact, is that there's been association recently and a great bit of concern about men who take protein shakes when they're exercising and the effect this can have on sperm. So we definitely recommend that you avoid protein shakes. And this is because we believe that there's some substances, possibly some steroid derivative, that are within the protein shake that can have a drastic effect on sperm. So please, if you're taking those, stop. Make yourself your own protein shake with banana and some milk and whatever else you fancy in it. Definitely the best way. So what else can I tell you? We talked about nutrition. One thing that I left out, I think, is leafy vegetables. Leafy vegetables are really important for men, particularly. Leafy green vegetables are full of selenium and zinc, and they're really good to help promote good sperm quality. So make sure, as well as the protein that I mentioned earlier, that you get lots of the green leafy vegetables into your diet. Okay, so supplements. A lot of people ask me about supplements, and supplements are very important for fertility. I'm not a big fan of women taking lots and lots, and men too, taking lots and lots of supplements for the sake of it. But there are a few that are really important. So for women, taking folic acid is your number one supplement. And ideally, if you're just starting or thinking about trying to conceive, if you can start taking folic acid for 3 months before trying to conceive, then fantastic. But if not, don't worry, just start taking it as soon as you want to start conceiving, and continue taking it. So folic acid is really important. The other one that's important is vitamin D. Now, luckily, we've not had a bad summer. We've had a fair bit of sunshine. So hopefully your vitamin D levels are pretty up. But as we come into autumn and the winter now, your vitamin D levels will decline. So you need to kind of give that a boost. So taking a good vitamin D supplement constantly, every day, is important. And it's also vital for men as well. So not just women. You both need to be taking the vitamin D supplement. It is believe that vitamin D can be associated, or certainly low levels of vitamin D can be associated with poor fertility. So vital to get that one on board. The third supplement that I recommend is a good omega-3. Now, it's crucial to find a good omega-3, and if you're struggling, please contact me and I can give you my recommendation of the one that I recommend for my patients. The one that I recommend for my patients is very low in toxicity. A lot of omega-3 is high in heavy metals and plastics, and that's because our oceans are so dirty. So I've sourced an omega-3 which is a very good quality, is low in toxicity, but also high in the crucial elements of omega-3, which is EPA and DHA. So please let me know if you'd like a recommendation on that one. The next thing that I want to talk to you about is tracking your cycles. So it's important to identify when you're ovulating to maximise your fertility potential. Now, the life of the egg is only 12 to 24 hours. And when you consider that, you think, how on earth does anyone ever conceive? But the life of the sperm is 5, possibly even 7 days in the vagina. So that does give you a fertile window when you have the ability to conceive. So it's really important to kind of start tracking your cycles, however you want to do that, so that you can identify your fertile indicators, and that will show you when your fertile time is. Now, this is a really big topic and perhaps one for a webinar in the future, and I'd love to chat to you a bit more about that, because there is so much that you can learn to improve your chances of conceiving through identifying when you're fertile. But some women choose to do that using fertility app or monitor, and I'm going to be talking a little bit more about that in one of the videos coming up, so do have a listen. Or you can use basal body temperature recording to identify or help you identify when you're fertile. But it's quite important to get quite a lot of information about it, because it is quite an extensive topic, so we will cover it in a future video or webinar, so do keep tuned for that. If you have any questions, please feel free to come back to me. I'm more than happy to help. You can reach me on email at kate@yourfertilityjourney, or you can find me on Instagram at yourfertilityjourney. So I look forward to hearing from you and answering any questions, and please keep tuned to watch the next video. Bye for now.